Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
So yes, my name is Steve Curran. I'm a family physician here in Fremont. I've been in Fremont for 20 years now, so I'm hoping to tell you a little bit more about what your vital signs really mean and what the doctors are looking at when they take your vital signs. So everybody knows, a little bit about the vital signs. What are they? Well, of course you have the basic ones, the temperature, your pulse, respirations, and a blood pressure. But I'm also going to talk about a couple more today, but let me get started. So what is your normal body temperature? I'm going to give you a little quiz. Is it 98.6, 96.8, or would you vote for something just slightly above room temp? Now I had a patient of mine who said, I get up every morning, have a cup of coffee, read the paper, check my temperature, and if it's something above the thermometer on the wall, I guess he's okay to keep going and get on with his day. But the truth is, the normal body temperature is highly variable. In adult men and women, the normal range for oral temperature is somewhere between 92 and 101 degrees. Now, somebody with a normal body temperature of 92 degrees is not common. But the point being that it is still highly variable. It can depend on a lot of things. The time of day. For example, within each person, their body temperature may change 1 degree during the day. It's typically at its lowest about 2 hours before they wake up, and highest usually in the late afternoon or on a hot day like today. Your body temperature can increase after eating. And we all know kids, especially if they run around or are very active, will have a little bit of a higher temperature. But it's also important to notice that the elderly may have a decreased ability to generate body heat, so a low-grade fever may still suggest a serious underlying problem. And temperature depends, of course, on which part of the body is being measured in. So when we put all that together, the average median daytime temperature in healthy adults, well, if you take it oral, the average is around 98.2 degrees. If you take it axillary, it's about 97.6 degrees. And rectally, about 98.6 degrees. But of course, it kind of depends on how it's taken. With oral temperatures, they can be very much influenced by eating. For accurate oral temps, one should not eat, drink, or smoke for at least 15 minutes prior to checking their temperature. We have folks all the time at the clinic that come in and their temperature is 95 degrees. First thing we ask is, have you had anything to drink? Oh yeah, I just had a glass of water 5 minutes ago. So again, that's one thing to keep in mind when checking temperature. Another important factor is that even with rectal temps, and perhaps with skin temps, that one may be having a fever, but because rectal or core temperature sometimes lags behind, it may take a few minutes before that registers as a fever rectally. And of course, various measuring devices can have their input. There's risk from glass thermometers. I don't know if anyone even has a glass thermometer these days. And remember the old glass thermometers that actually had mercury in them? Well, you don't see too many of those nowadays because of risk for mercury poisoning. So we'll tend to use little devices like this, these electronic thermometers, which are fairly accurate and reliable. I'm not a big fan, though, of those plastic strips you see where folks put those across the forehead. Those can be highly variable. And sometimes, even though they can be quick and convenient to use, the ear thermometers also sometimes tend to give variable results, so we have to be cautious about interpreting those. So if you know your temperature, then how do you define a fever? Well, in most cases, an oral temperature, if it's between 96.9 and 99.5, that's probably going to be normal. So we typically define a fever as something more than 100 degrees. But it's important to note that the height of the fever doesn't always tell how severe the infection is. For example, it's not unusual for a small child to run a fever of 104, whereas an adult, a fever of 104 would tend to get more attention. That may be more common in children. But again, even a low fever, a low temperature, may in some cases be more serious than a high fever. And it's important to note that certain medications, Tylenol, Advil, aspirins, even prednisone, may affect your body's ability to mount a fever and can affect the readings. Now, on a hot day like this, a good question is, well, how do you tell the difference between a fever and hyperthermia? Well, with a fever, it's actually your body's core temperature rises through the action of the brain. Your body is telling itself to raise its temperature, perhaps in response to a virus or infection as a way to fight off the infection. Whereas with hyperthermia, the body's core temperature is raised without the consent of the heat control centers in the body, which is why it may in many cases actually be more dangerous. So moving on to the next vital sign. So what is a normal heart rate? Well, we define heart rate as just the number of beats per minute. Of course, we all know you can check that in the wrist, but you can also take your pulse in the elbow, neck, in the groin, or actually straight at the source, right over your heart. Resting heart rate, the typical resting heart rate in adults will be between 60 and 80 beats a minute. We use the term bradycardia to refer to a slow heart rate when it's less than 60, and tachycardia when it's more than 100. But many folks have resting heart rates less than 60. Certainly if they have regular exercise, that may be the case. If they're on certain medications like metoprolol or other beta blockers, they may have a resting heart rate that's less than 60, less than 50. In some cases, very conditioned athletes, Tour de France bicycle riders, sometimes have resting heart rates in the 20s. In addition to checking pulse, you'll often hear the doctor or the nurse describe the regularity, meaning is the pulse is 55 and regular or 72 and irregular. So what does an irregular pulse really mean? Well, sometimes it may be normal. For example, in younger folks, teenagers, their heart rate may increase and decrease naturally with respirations. Other times, an irregular heart rate may be a sign of a medical problem, like atrial fibrillation or even things like premature ventricular contractions, those little extra skipped beats that everyone gets, but if they're frequent or strung together, then it may be a problem. So a lot of folks are interested in how to calculate their maximum heart rate. They may be exercising and want to know just how high is it okay for their heart rate to go. Well, the best way to do that is actually under monitored circumstances with a cardiac stress test, but that's not always practical. So sometimes we'll use a basic formula for calculating that. A common formula is to take 220 minus the age. For example, if you're 50 years old, 220 minus 50, around 170, beats a minute would be the target for the maximum heart rate. But a little bit more accurate formula would be the one I described there, where you take 191.5 minus 0.007 times the h squared. But yeah, the target heart rate for aerobic exercise for the heart and lungs to get the most benefit, we typically will quote something between 65 and 85% of that maximum heart rate. It may be more important not to know what your maximum heart rate is, but to assess your fitness to measure your recovery heart rate. Now, after exercising, recovery heart rate can be determined by taking the heart rate at the end of exercise minus the heart rate about a minute later. We'd like to see that drop at least 20 to 30 beats. If that's the case, that suggests your heart's in good shape, that it's able to accommodate the exercise and recover fairly quickly. A heart rate drop less than 20 may suggest some increased risk of heart problems, and if it drops less than 12 beats, that's actually been linked with increased risk for more serious heart problems. So moving on to the next vital sign, sometimes we consider the most important would be the blood pressure. And a lot of folks ask me, what do those blood pressure numbers actually mean? The systolic is the top number. For example, if we say 120 over 80, 120 is the systolic, or the top number. And that number measures the pressure inside the artery when the heart beats or contracts. And you can think of the diastolic, or the bottom number, is the pressure in the artery between beats, when the heart's most rested. So what should your blood pressure be? So the blood pressure norms, I put up in a little chart here. We'd like the target normal blood pressure for folks, adults of all ages, to be less than 120 on the top and less than 80 on the bottom. We start to use the term pre-hypertension or elevated blood pressure if the top number is between 120 and 139, or the bottom number is between 80 and 89. But then we actually use the diagnosis of stage 1 hypertension if the top number is above 140, between 140 and 159, or the bottom number is between 90 and 99. For example, if your blood pressure is 120 over 92, even though the top number is okay, that bottom number is still elevated. That would be considered stage 1 hypertension. Especially if it's consistent readings along those lines. If your blood pressure is 145 over 88, even though the bottom number is okay, it's still considered hypertension. And we go up to stage 2 if that top number reaches above 160 or the bottom number reaches above 100. And then we actually consider it a hypertensive crisis, something in probable need of more immediate attention if that top number is above 180 or the bottom number higher than 110. Now I have another question for you. Just because you're over 50, is it okay for your blood pressure to run a little higher? Well, the truth is that's common. The older we get, it's much more common to have higher blood pressure, but it's no less a problem. So I guess the answer would be false. It's not okay. And what about if your blood pressure is on the low side? Generally, folks, if their blood pressure is above 90 on the top, they're not going to have symptoms unless that's a change from their normal. If their normal blood pressure tends to run in the 120 range, and then all of a sudden, for some reason, it drops down into 90, that lower blood pressure could cause symptoms, dizziness, fainting, whatnot. And sometimes low blood pressure can be a sign of sepsis, which is a severe infection throughout the whole body. Hemorrhage, where a serious source of bleeding somewhere in the body. Toxins, even a side effect of blood pressure medication, or dehydration. So again, which number is more important, top or bottom? Both. And again, we consider, especially in folks over 50, we often give more attention to that top number. So how should you measure your blood pressure? Well, ideally, for 5 minutes before the reading, you would sit upright in a chair with feet flat on the floor, relaxing, arm relaxed and kept at heart level, and the blood pressure against the bare skin rather than over clothing. And again, avoiding coffee, cigarettes, strenuous exercise right before eating or before taking the measurement. And again, a lot of factors can affect the blood pressure reading. It can vary throughout the day. Best times to check it are usually first thing in the morning before the stress of the day hits, or after finishing work. Worst place to take it is in the doctor's office. Even though we have all the fancy schmancy calibrated equipment, it's perhaps the least reliable place to get accurate blood pressure readings. Something we call white coat hypertension, which I didn't wear my white coat today, but it's important to note that up to 25% of patients, in my experience maybe more, reading in a doctor's office is typically higher than what they would get at home or in their native habitat. So it can be useful to get home blood pressure readings, and there's different devices that are useful there, from home blood pressure cuffs. On occasion, you may even see your doctor order an automatic ambulatory blood pressure device, which is a blood pressure cuff that they'll hook up to you, which you walk around with for 24 hours, and it'll take frequent readings and record on its internal monitor. But that's not commonly done. It's much more common for folks to check blood pressure readings at home with their own blood pressure cuff. And the question I get frequently is, can I trust those? Can I trust the readings that I get at the pharmacy or the grocery store? And the answer is perhaps. In most cases they're reliable, but what I'll do is I'll ask folks to bring their blood pressure cuff to the office. If their cuff and our cuff agree, I'll tend to believe the readings that they get at home. Even though the readings they may get in the office may be high or not necessarily reliable, if their machine and ours agree, then I think we can most likely rely upon the readings they're getting at home. So the next vital, what is a normal respiratory rate? Well, of course, the respiratory rate is just the number of breaths you take in a minute. But this one's a little bit harder to define. You know, if you've ever had the doctor or the medical assistant ask you to, maybe be quiet for just a moment, I'm going to monitor your respirations. Of course, the first thing you do is you're aware of your breathing, and that affects the rate at all. So assessing respiratory rate can be very difficult and hence highly inaccurate. The rate for adults is usually between 12 and 20, but for newborns, normal rate may be 44. For children, 16 to 30 range. But again, a lot of factors, crying, level of alertness, agitation can affect that. So sometimes when we really want to assess their respiratory status, sometimes we'll use another device like a pulse oximeter. Your doctor may have used one of these on you before. You can see with this little device the oxygen saturation is 97% and the pulse rate is 66. In most cases we're happy if it's above 90%, but again, that's a tool that's sometimes used. So other vital signs I want to touch on briefly. I put up a chart here. It talks about height, weight, and you may have heard of that BMI or body mass index. There are ways that we can get an estimate of one's percent of body fat. And you can see in a complicated chart like this, based upon height and weight, you can get a basic idea if you're in the underweight, healthy, overweight, obese, or extremely obese range. But I'll be honest with you, in my 20 years of practice, I've yet to find one patient that needed me to tell them if they were overweight. But again, sometimes it's a useful tool. For example, certain things, some insurances require body mass index measurements before they'll cover certain treatments, weight loss surgeries, for example. But on the other hand, the body mass index is a somewhat limited measure. For example, these two folks, these two fellows are both 6 foot tall, and they both weigh 250 pounds, and they both have a body mass index of 33.9. So they would both be categorized as overweight, but as you can tell, they're not in the same body composition. What we'd really like, ideally, would be to have a measure that tells you your percentage and distribution of body fat. We know it's that body fat that's packed underneath the abdominals, around those internal organs, that's the most dangerous, but we don't have a simple way to measure that. The simplest tool I've still found is, can you pinch an inch? One more vital sign I want to talk about is the physical activity. Several national bodies have come up with a national physical activity plan. And as part of that, they've asked physicians to start registering patients' physical activity as one of their vital signs. In a nutshell, the aim is to go for 2.5 hours, moderate physical activity a week. So that's one of those things you can start recording as well. Well, that pretty much does it for my presentation here, a simple outline of the vital signs and things to look for, but I'd love to answer any questions you can think of.
I've never understood if there's a correlation between a pulse, which I'm not sure what creates it, versus your blood pressure.
That's a good question, yeah. Pulse is basically a representation of the heartbeat. Every time the heart beats, it creates a pressure wave that's felt as a pulse somewhere in the body. The most common pulse we think of is here in the wrist, but it can be elsewhere. And with each beat of the heart or each pulse, the blood pressure tends to go through a wave. The pressure goes up, and the pressure goes down. Now, the pressure never goes down to zero. It stays at a certain level, and that's that diastolic or that bottom. Now, if your pulse increases, it doesn't necessarily mean that your blood pressure increases. And if your pulse decreases, it doesn't necessarily go down. So in one way, they're linked, but on the other hand, they're not necessarily correlate with each other. So a lot of the blood pressure machines will also measure your pulse rate. And sometimes we're interested in that, but to tell you the truth, that's just sort of a side benefit. It's what we're really after when we're measuring that blood pressure is the pressure.
How do you feel about the wrist blood pressure cuffs that have come out?
The general feeling is that they're just not as accurate. Now, honestly, I've seen patients that have come in my office where the wrist is given very reliable numbers. That their machine and my machine agree, they get consistent numbers at home, but as a general rule of thumb, I'm a little skeptical.
I have checked blood pressures on both an arm cuff and then on the other arm a wrist, and they seem to be very close, at least on the cuffs that I have.
Yes. Yeah, a lot of patients give me that experience as well. And so I always tell folks when they get a blood pressure cuff, save their receipt. Sometimes for whatever reason, you'll just get a machine that just doesn't jive well with your anatomy and just doesn't give reliable readings. So,
Also, the most recent information that I have read is that 120/70 is the cutoff line. for
Well,
blood pressure rather than 80.
That's a good point. I mean, it's not this black and white line that once you cross, you're good and or bad one way or the other. It seems to be a continuum, meaning if we're really asking what's ideal blood pressure, again, that may vary by individual, but I don't have reason to think that it's a blood pressure of 110/70 is probably even better than 120/80. I guess the question we think of in the real world is, well, okay, at what point do we really need to start treating this? At what point do we need to introduce changes in diet or lifestyle or look at medication? And that's what we're still trying to figure out.
On the heart size,
Yes.
what you can tell us between the enlarged heart and the small one, and what caused the enlarged size?
Well, the enlarged heart can have a lot of different causes as well, and one of the major ones is high blood pressure. When that heart is pumping against a very high blood pressure for a long period of time, it tends to grow to try to accomplish that goal. Sometimes the heart, after years of trying, may just start to dilate and the muscle weakens and the heart becomes a large floppy bag. So in some cases, an enlarged heart can certainly be a problem. Yeah.
You have mentioned for hypotension, there are side effects of BP medication. What are the side effects of BP medication? And my second question is, the readings between an analog BP apparatus and a digital apparatus. Thank you.
Well, blood pressure medications sometimes work better than anticipated, may lower blood pressure. Beta blockers, for example, can certainly lower heart rate and then associated blood pressure. So one of the first things I'll ask if folks come in with a low blood pressure reading is, what was recently changed with your medication? Did you happen by mistake to take an extra dose? That type of thing. So almost a universal side effect of any blood pressure medicine would be hypotension, or too low a blood pressure. In most cases that's unusual to drop blood pressure down too far, but not unheard of. And your second question about the difference between sort of analog and digital blood pressure cuffs, for most purposes I would consider the automatic digital ones more reliable. But it's very user dependent, very individual dependent. So again, in any situation like that, you just have to trust but verify. Correlate with other machines, and if you're getting consistent readings that seem to make sense, then it's probably reliable.
Thank you.
Thank you.
Okay, let's thank Dr. Curran.
Thank you.